जब आप कैंसर टर्म सुनते हो, you don't think of a cure. It just like gives you no hope for whatever time, when till the time you don't really get to know what is it in future for you. I think the name cancer, itself carries a lot of negative feelings for the patients and people around.
Cancer is something which makes people so nervous. They think that it just means bad news. But it need not be so, because many cancers can be prevented, and many cancers, if detected early, will have no bad impacts on the patient's quality or length of life.
Cancer is a disease wherein your own cells, they start multiplying uninhibitedly, and because of that, whatever nutrition should go to your normal cells, your normal body functions, all of that gets directed there, and that is why your whole metabolism gets affected, your whole body gets affected, no matter where the cancer is.
Many times the patients come and ask, do I have a cancer or a tumor? Any abnormal growth is a tumor. It may be an abscess, it may be a boil, it may be a carbuncle, it is a tumor. These tumors are classified as a benign and malignant, that is cancerous or non-cancerous.
%10 of all cancers are hereditary. It can be in your gene, it can be passed on, it can run on generations, and it can be passed on from the first generation to further generations. For example, I'll just tell you the story of Angelina Jolie. It was quite some time back when her mother was diagnosed with advanced ovarian cancer. Because she fitted into the criteria of ovarian cancer and breast cancer syndrome, she was tested for her BRCA gene. So the BRCA gene basically stands for the breast cancer antigen, and her mother was tested positive for the mutant gene or the faulty gene. It increases the risk of both ovarian cancer as well as breast cancer.
Cancers in their early period tend to be asymptomatic, and women may never know they have an abnormality, and usually they cause pain as a late stage, or pressure symptoms when they are grown big and impacting neighboring organs, or in some cases they impact the function, and so you get to see them.
When we talk of gynecological cancers, that means we mean the cancers of the uterus, the cancers of the cervix, then both sides we have the tubes, that is the cancers of the fallopian tubes, ovaries, vagina, vulva. So these are the parts of the gynecological system, and cancers from any of these parts, we call them as a gynecological cancer as a single term.
For uterine cancers, which are getting more and more common now, as obesity increases, diabetes increases, and that syndrome makes kind of a picture, and we have the metabolic syndrome, and we see a lot more of uterine cancers now, which is very, very getting to a scary proportion.
These are the cancers which is seen more in the urban population. So these are the women who have a strong lifestyle, who have more of a sedentary lifestyle, more of fatty food, diabetes, hypertension. So these are the women who are more predisposed to the ovarian or the uterine cancer. And so we just need to suspect any kind of bleeding, any vaginal discharge, any abdominal pain. They should be looked into, they should not be neglected.
मेरे को पीरियड्स बंद हो गए थे और 10 साल हो गए थे, तो एकदम मेरे को हुआ, ये क्यों हुआ मुझे पता नहीं था। तो मैं डॉक्टर के पास गई, घर के पास ही डॉक्टर थे, तो उन्होंने मुझे बोला कि आप जाके कुछ इन्फेक्शन है, आप जाके पैप स्मेयर करवाओ टेस्ट। वो करवाया तो उसने बोला कि आप कहीं हॉस्पिटल है, वहाँ जाके DNC करवाओ आप।
Initially the woman never comes to a cancer specialist. She goes to her own primary physician, she goes to the local, the nearest doctor who is available. So probably this is also the time that we get our doctors trained. Even the MBBS, in the MBBS syllabus, it should be diagnosing cancer should be introduced in the medical syllabus, how to diagnose cancer early.
जब रिपोर्ट आया तो पता लगा तो एकदम शॉक लगा, डर गई, क्योंकि वो तो एकदम ऐसी बीमारी है कि जो जान लेने वाला है.
The first thing that comes in the patient's mind or the family's mind, that why me? Why not somebody else? So this is the first thought that comes to a patient's mind. The second thought that comes is that, did I do something wrong in my past? So these are the questions which haunt the patient's mind.
The first difficult thing was to tell the news to her, and to be very honest, we didn't tell her that she has cancer. At the very first moment, we lied to her that you have a severe kind of an infection in your uterus, hence your uterus needs to be removed, and that's what we told her. So when she was admitted in the ward, I used to go up to the nurses and tell her that do not share that she has cancer, we haven't told this to her. And then likewise, I sat with Dr. Swarupa Mitra and I told her that she's not aware that she has cancer. Maybe she's somewhere deeper inside her heart she knows, but we haven't told this to her like directly on her face. And I remember her statement still. She said that it is entirely your choice that you don't want to tell this to her, but if you want, I can counsel her. When I went back home, I thought about it. But again, did not have the courage and have the strength to really break the news to her, because it would have been a very emotional thing, like everybody crying together in the family, saying that she has such a big disease.
इसमें बहुत ही अर्ली स्टेजेस में सिम्टम्स आ जाते हैं एंड 70 to 80% जो पेशेंट्स होते हैं वो स्टेज 1 के होते हैं. अगर बीमारी स्टेज 1 में पकड़ी जाए तो द क्योर रेट इज़ ऑलमोस्ट 80%. सो व्हाट इज़ आवर रोल? यू हैव टू बी अवेयर. आपको ये बात पता होना चाहिए कि अगर ये सब हो रहा है तो आपको तुरंत डॉक्टरी सलाह लेनी चाहिए. इमीडिएटली गो एंड विजिट योर गायनेकोलॉजिस्ट.
She was menopausal when she spotted, and the day she spotted, the very next day she went for a pap smear test. So what I really appreciate that she did not sit on it even for one extra day.
About one woman dies every 7 minutes out of cervical cancer in India, and that's a huge number.
We have a whopping 67,000 women dying every year of cervical cancer, which is actually more than the numbers dying of maternal mortality.
सबसे बढ़िया बात सर्वाइकल कैंसर की क्या है? ये है कि हम इसको एक्चुअल कैंसर होने से पहले ही पकड़ सकते हैं.
There may be no symptoms initially, and that is when it's important to do tests like the PAP, which look at the cells and detect them like 10-15 years before it develops cancer. So you detect the pre-cancer, you treat the cancer never comes. So cervical cancer in its slightly more advanced stage could present with an intermenstrual bleeding, a postcoital bleeding, persistent discharge, or sometimes the gynecologist looking at it says, oh, it looks a little unhealthy, and that is actually just an abnormality showing up.
And in advanced cancer, the symptoms are slightly different. So it may be a feeling of heaviness in the abdomen, it may be a feeling of heaviness in the back, pain in the back, burning in urine, or sometimes maybe an obstruction in the urine, obstruction in the rectum, a feeling of heaviness in the rectum, difficulty in passing stool. So these are the symptoms which may happen, which may occur in an advanced stage. A very common symptom which should not be neglected is a pain in both the thighs, a low backache, this is very, very common in women, otherwise also. So a low backache radiating to both the thighs. It may, many times it is neglected as a sciatica, a pelvic pain or a lumbosacral pain, but this may be a symptom of an advanced cancer cervix.
Human papillomavirus is the most common cause of cervical cancer. It causes roughly about 99% of all cervical cancers all over the world.
ये वायरस तकरीबन सब में, all ladies who are sexually active, उनमें ये होता है. For most of them, 70 to 80% of the times ये जो वायरस होता है ये अपने आप ही वॉश आउट हो जाता है. अब ये आपके शरीर में है या नहीं है, और ये आपके शरीर में कैंसर कॉज कर रहा है कि नहीं कॉज कर रहा, ये हम कैसे पता लगा सकते हैं? 2 बड़े सिंपल टेस्ट हैं. एक तो है पैप स्मीयर, जो यूट्रस का माउथ है, दैट इज़ द सर्विक्स. एक सिंपल से स्पैचुला के साथ उससे थोड़े से सेल ले लेते हैं, एक स्लाइड बनाते हैं, उससे हमें पता चल जाता है कि उस पर ये कैंसर धारक सेल्स हैं या नहीं है.
HPV is necessary but not sufficient. So what are the cofactors? Early age, sexual activity, multiple partners of yourself or of your partner, and even maintaining proper menstrual hygiene, genital hygiene, and preventing infections locally. Smoking is not a big factor, but it is a factor. Very many long years of contraceptive use, hormonal, might also be a factor. We have the HPV vaccine now, and if given before girls are sexually active, preferably in the ages under 15 years, then these girls can prevent around 85% of cancers which in India are caused by the HPV 16 and 18, which are the main causative agents of cervical cancer.
3 shots of vaccine could ensure you against a cancer. Why it is suggested in 9 to 11-year-olds is that is the best time when your body immunity is strong and the immunogenicity of the vaccine and the efficacy is achieved to the maximum threshold.
Nowadays we are getting very young patients who are coming with cervical cancer, and she undergoes treatment. She has this question in mind whether she will bear children later on or not. This is a very pertinent question. Yes, a cervical cancer patient who has not undergone a surgery, or for that matter any cancer patients, they can bear children.
We always had screening, which women in India unfortunately have not taken seriously and not come back regularly for pap tests every 3 years like they should. And if we were to do that, we would be able to prevent at least 70% of cancer death.
The 5-year survival rates of stage 1 cervical cancer is as high as 80 to 90%. This is a very dangerous kind of cancer. क्यों? इसलिए कि इसका पता ही नहीं चलता.
Ovarian cancers are picked up in stage 3, so that makes it advanced stage at presentation, and there is no way it could be picked up by screening.
This is the cancer of women who have a sedentary habit, more of fatty food and less of exercise, obesity, diabetes, hypothyroidism. These are all the predisposing factors for these kinds of ovarian and the endometrial cancers.
In younger girls also there's a type of ovarian tumor like a germ cell tumor. So any increasing girth of the abdomen, any change of any kind should be looked at by the doctor.
This is known as the silent killer because धीरे धीरे इसके symptoms आते हैं, धीरे धीरे पेट थोड़ा सा बढ़ जाता है, आपको पता ही नहीं चलता कि इसमें पानी हो गया या एक इसमें आप बहुत बड़ा ट्यूमर हो गया, आप सोचते हो थोड़ा ज़्यादा खा लिया इसलिए शायद मोटापा हो गया, उम्र भी बढ़ रही है तो शायद इसके वजह से है, कम घूम फिरते हैं इसलिए हो गया. लेकिन आपको याद होना चाहिए कि अगर आपको डिस्पेप्टिक सिम्टम्स हो, इसका मतलब हाजमा ठीक नहीं है, भूख ठीक से नहीं लग रही, मन उचाट सा हो रहा है और ये इंस्टेंस आपको महीने में 7-8 बार ऐसे हो गया, आपको इमीडिएटली डॉक्टर के पास जाना चाहिए क्योंकि हो सकता है ये ओवरी का कैंसर हो. ओवरी का कैंसर हम जब डिटेक्ट करते हैं 70 to 80% ऑफ द टाइम, 70 से 80% तक ये तीसरी स्टेज में ऑलरेडी पहुंच चुका होता है और तीसरी स्टेज में इसका क्योर रेट सिर्फ 40% है.
Ovarian cancer is the one where it is very important that these patients be managed at a facility where there is a good gynecological oncology expertise because a lot depends on how well the first surgery is done, and it is important that it is taken out to the extent possible with taking in removing sometimes some portions of intestine or wherever the tumor is. So while that becomes a very extensive surgery, but we've seen plenty of evidence on how well it does. So if at all there's an ovarian cancer, please do not hesitate to travel if required to find the right surgeon to see that your surgery is done well, and do not miss your chemotherapy because then that whole surgical effort gets undone. It needs the collaborative work of various disciplines to see you through.
कैंसर कोई भयंकर बीमारी नहीं है, इस पे सफलता हासिल है. नई नई टेक्नोलॉजी है, नए नए डॉक्टर हैं, क्वालिफाइड डॉक्टर हैं, बहुत अच्छा सिस्टम है. अपने आप को डॉक्टर के मुताबिक चलिए.
Nowadays there are 4 treatments: surgery, chemotherapy, radiotherapy, immunotherapy and targeted therapy. Not all cancers need all the 4, but gynecological cancer is such a cancer. Most of the times we need a permutation combination of surgery, chemotherapy, radiotherapy. None of these treatments are scary these days. So we have got various very nice modes of surgery, very advanced modes of surgery where the patient is discharged quickly and she has less of side effects.
जिस सर्जरी को आगे 7-8 घंटे लगते थे, 8-10 बॉटल ब्लड की ज़रूरत पड़ती थी, 3-4 बड़े बड़े सर्जन चाहिए थे, आज की तारीख में वही सर्जरीज they take maybe just a couple of hours. You hardly need any blood. There is so little tissue damage, and the patient walks into the hospital and walks out. In surgeries, you now have robotic surgeries, which are absolutely ideal for the fat, obese woman who has endometrial cancer.
Sometimes we do surgery before, sometimes we do surgery after some chemo, so all that is to be decided on the individual case.
Please do take treatment and do not think कि मैंने कीमोथेरेपी ले ली, मेरे बाल चले गए, मेरे नाखून चले गए. अरे बाल चले गए तो क्या है, घर की खेती है, फिर आ जाएंगे. Don't think of it in these terms that I will lose my hair. It's only hair, isn't it? You're not losing your life. कुछ कीमोथेरेपी ऐसी भी हैं जिनमें बाल नहीं जाते, कुछ में जाते भी हैं, कुछ में नाखून थोड़े काले पड़ जाते हैं. फिर क्या हुआ, फिर से आ जाएंगे.
डॉक्टर ने बोला तो उन्होंने बोला कि हमें इसके आपको रेडिएशन करवाना पड़ेगा. तो हमें उसके बारे में कुछ पता नहीं था, रेडिएशन के बारे में क्या होता है. तो मैं डर गई, रेडिएशन कैसा होगा. तो मुझे किसी ने बताया कि कुछ सिकाई होती है. अब वो सिकाई क्या है, शायद वो हीट देंगे, मेरी जलन होगी शरीर में या कहाँ, मुझे कुछ मालूम नहीं था. तो मेरे को फिर हमारी डॉक्टर है स्वरूपा मित्रा, उन्होंने मुझे बोला कि कोई डर वाली बात नहीं है, आपको कुछ नहीं करना होगा, आपको बिल्कुल पेन नहीं होगा.
Talking of radiation, because this is something which is not touched, not many people, even the doctors do not know about radiation. It is nothing like being fried in a pan, nothing like an electric shock. These are simple x-rays which we used for an x-ray, doing an imaging. So these are the x-rays which are used to treat a cancer. Absolutely painless. Nowadays with better treatment machines, they are targeted. That means the normal areas are not touched at all. Less of acute side effects, less of chronic side effects. So most of the patients, they fare quite well.
We have made a lot of strides in palliative care also, and symptom control. So for all patients, we can definitely be sure that we will give them a good quality of life, and they will not suffer pain and they will not suffer symptoms to the largest extent possible.
The earlier a patient is diagnosed with cancer, your chances of getting cured are higher, and your financial burden, that means the issues with finances, your expenditures are less. But as the stages become higher, the chances of cure, they decrease and the expenditure increases.
A lot of women really don't think about themselves. They put everybody else in the family first, as naturally the way we are. But you must also realize that you are the pivot of the family, and you must also realize that your health will make a lot of difference to the family's health. You know how they say in the aircraft that first get your own mask and then worry about your neighbor.
तो मैं आपको क्या बताऊं किस तरीके से मेरा ट्रीटमेंट हुआ. वंडरफुल. मेन कंक्लूजन ये, और इनका सहयोग, वहाँ डॉक्टरों का, सफाई, व्यवहार, सब मुझे बहुत अच्छा लगा, जिसने मुझे आज यहाँ आपकी कुर्सी पे बैठा दिया.
डरना नहीं है बिल्कुल भी किसी बात के लिए कि कैंसर है. हम अच्छे पहले जाके अपना अच्छे से डॉक्टर को दिखाएं क्यों हुआ प्रॉब्लम है. जल्दी जल्दी डॉक्टर पास जाके अपना ट्रीटमेंट करवा सकते हैं हम लोग.
मैं सबको यही शिक्षा दूंगी, रोने से काम नहीं चलता, कुछ करने से चलता है.
Without her support, we couldn't have really done it.
Please go ahead and spread the message around in all your kitty parties, in all your satsangs, and in your household and in your family functions, that cancer is not a disease which will spread just by contact. It is not a stigma. It is absolutely curable if detected at an early stage, and definitely controllable even if detected at a later stage. So it is worth going to a doctor, it is worth spending money on, and it is worth saving such a life.
Most of our gynecological cancers do very well if detected early. So if you have a problem, you need to know and act fast.